As you all know, the Young Ophthalmologist launch is a series of webinars being conducted by the Scientific Committee of KSOS, mainly to highlight the young ophthalmologists who are in the initial phase of their career. This time, this webinar is being co-hosted by the Young Ophthalmic Leaders of Kerala and the Young Ophthalmic Society of India, and dealing with a very important topic, that is how to prepare for international examination. So on behalf of the scientific committee, warm welcome to the speakers, especially Dr. Devendra Venkatrami from Panvel and Dr. Dagan Mishra from Lucknow. Along with the host speakers, we also do have Dr. Samir Chowdhury from Aravind High Hospital, Madurai, and Dr. Pranita Sahai, who's yet to join. She is working in Guru Nanak Eye Hospital, New Delhi. So on behalf of the scientific committee, welcome all. And with these few words, I hand over the program to Dr. Raki de Cruz, who is the moderator of today's program. Over to you, Dr. Raki.
Thank you, sir. Thanks a lot. So, good evening, everyone. A warm welcome to today's webinar from the Young Ophthalmologist launch. So, our topic today is highly relevant and it is highly sought after because the FRC's exam slots are open and many of you might be already preparing for the exam. So, in this session, we are having a series of talks which are mainly directed on the international exams, and we'll be discussing strategies for successfully tackling some of these most prestigious international exams, which include the FICO, FRCS, and the FRC of. So this webinar, as Bastin sir said, is a collaboration between the KSOS as well as the Young Ophthalmological Society of India, bringing together both state level and national level speakers for a comprehensive learning experience. At the outset, I would like to thank the governing members of KSOS, especially our scientific committee chairman, Dr. Bastin sir, for being very supportive and for giving us this opportunity. And then I would like to especially thank our president of YOSI, Dr. Dagan sir, and secretary Dr. Nile sir for their guidance and their invaluable support in guiding this event. So without further delay, let me introduce the distinguished panelists for today. So first we have none other than the president of YOSI itself. One second, I'm just sharing. So is my screen visible?
Yes, yeah.
So our main panelist today is Dr. Dagan Mishra sir, who is the director and the lead surgeon, retina surgeon at Sonajedi Group of Eye Hospitals. He is also the president of Young Ophthalmological Society of India, and he was a past secretary of YOSI. He is a member of APAO YO Standing Committee and the member of International Committee VBS. He is a visiting fellow at Byers Institute, Stanford, USA, and he was a retina fellow from Sri Shankaradeva Netralaya, Guwahati. And he has got various awards and accolades to his honor. He is cited under the Business World 40 under 40 Healthcare Leaders 2024, and he has received Best Retina Surgical Video at the Retina World Congress USA in 2024, International Ophthalmic Hero Award from AOS the following years 2024, 2023, 2022, 2019, and 2018. He's also renowned as the best ophthalmologist in Lucknow for 2024, 2023, and 2022. Top 10 leaders in eye hospitals in India cited by the CEO Insights of Asia 2023. Top 20 rising stars in ophthalmology in the Asia Pacific region in 2023. And he has won so many awards, so many APAO Achievement Award, and also Best of Indian Journal of Ophthalmology Award in multiple years. So we are very honored and grateful to have you here, sir. So Dagan sir, so I would like to ask you to give a few message to the young ophthalmologist of Kerala as well as Pan India on how to be proactive like you and how to follow their dreams of writing this international ophthalmological exams and applying for fellowships outside India. Over to you, sir.
Thank you so much, Raki. And at the outset, thank you for this detailed introduction and taking this very important initiative of talking and discussing about these exams. And special gratitude towards the Kerala Society of Ophthalmic Surgeons, which is represented by Dr. Baston Anthony sir here today. And it's a great initiative. And I got a lot of queries about this session, and a lot of people after a very long time asked for the link of a webinar. So I'm sure it will be appreciated by all because the lineup is really good. Uh, and yes, it's important to appear for these exams. Whether you want to move abroad or work there, that's I think secondary. But challenging yourselves with these exams, being at par with the international standards is really important. And all the exams that are being talked about here today have very high standards, and getting these post nominals, the knowledge that you acquire from these exams are very helpful in whatever we want to pursue. And of course, these help if you want to work abroad and settle down there. So let's listen to what our speakers have to say here today and learn from them. Thank you, Raki, for this great initiative.
Thank you, sir. So our next panelist for today is Dr. Devendra Venkatraman, sir. He is currently working as a consultant at vitreoretinal surgeon at Lakshmi Eye Hospital, Panvel, Pune. And he has done his MBBS from Bairamji Chiboy Government Medical College, Pune, and DNB Ophthalmology from Shankar Nethralaya, Chennai. And he was a project consultant for the Indian Institute of Technology, IIT Madras. He has done his fellowship in surgical retina and uveitis from LVPA Hyderabad. He holds FRCS, FICO, MRCS, everything. And he's the immediate past president of Navi Mumbai, Raigad Ophthalmological Association. He has numerous textbook chapters and scientific papers to his name. He's actively involved in postgraduate education, and he is the associate section editor, Surgical Retina of Indian Journal of Ophthalmology since 2016. So other than that, so he has got a significant experience with all these international ophthalmology exam, and also has got successfully mentored numerous young ophthalmologists in India for their preparation regarding this prestigious exams. So now we would like to hear from you, sir, on how to prepare and how to go about and what is a real life scenario and need for these exams. Over to you, sir.
Thank you, Dr. Raki. A pleasure to join all of you on this nice evening. Special thanks to KSOS and Yossi for the invite. I think we have a great lineup of speakers who are going to cover all of these topics in detail. My experience with the Royal College exams and with the ICO exams is now more than a decade and a half old, and I have been inspired by my teachers, especially during my training and during my DNB itself, Dr. Ashmin Gandhi and Dr. Meenakshi Swaminathan especially. I'd like to acknowledge their guidance during this process. I the examinations themselves have evolved over the last many years, and things are constantly on the change. It's a very dynamic situation. So I encourage everybody who is interested in giving these examinations to really understand the entire process, because it's a long process. It's not a single examination, it's a series of examinations. And getting into the nitty-gritty of that will be taken up during this webinar. But I wish everybody who's appearing for these examinations all the best, and I'm sure everybody will do well. They're not difficult examinations to crack. They require a little application. At Lakshmi Eye Hospital, we've been running a FRCS refresher course for the last 7 or 8 years. And we do some hands-on training, especially for people who are appearing for the final parts, that is the clinical examinations of the FRCS Glasgow. So I'm happy to help in that regard, and I look forward to interacting with you during the course of the webinar.
Thank you, sir. So moving on, let me introduce the speakers for today. So our first speaker is Dr. Samir Chaudhary. He will be talking on FICO basics and optics. He's a medical officer at Arvind Eye Hospital, Madurai. He is an executive member of YOSI. He has published over 20 research articles and authored book chapters. He is the runner-up ophthalmic wars at UPCon, and he's the first prize winner of cataract image competition, and he has numerous accolades for quiz competitions, research and debates at the institutional level. And he's also currently in charge of innovation cell of YOSI. So over to you, Samir. We are happy to have you here. So please share your presentation. Yeah. Wonderful screen mode.
Thank you, ma'am, for the kind introduction. So, a very good evening to one and all. So, I'll be at the very outset, I would like to thank the KSOS and YOSI for giving me this lovely opportunity. So, in this talk, I'll be providing an overview of FICO and how I prepared for Part A and Part B. So ICO basically, as everyone knows, stands for International Council of Ophthalmology. It is a prominent global organization which was established in 1857 and is currently headquartered in Geneva, Switzerland. It includes over 180 national, regional, and subspecialty societies, one of which is Young Ophthalmology Society of India, and it focuses on education and advocacy in ophthalmology. So education, we'll be mostly talking about education. So it facilitates education through various fellowships. It organizes the World Ophthalmology Congress and its famous examinations. So talking about the ICO examinations, they have been divided into two sets as standard and advanced. Standard consists of three parts. Part A, which is visual sciences. Part B, which are optic refraction and instruments, and clinical ophthalmology, which is Part C. So once you clear, so Part A and Part B can be given in any order and can be given together as well. However, for giving Part C and the advanced examinations, you have to finish the preceding parts. And Part A and Part B are together referred to as basic sciences. So why should one give FICO examination? So what is the purpose and the recognition? So it confers the post acronym or the title of FICO. So you basically get a degree which is very well recognized. It enhances the candidate's qualifications for international fellowships and career opportunities. So obviously there's a certain amount of skill and knowledge which is required to clear the exam. So basically having that title of FICO definitely establishes of your skill and your knowledge. So these examinations, because of that, are recognized globally. So if I'm seeking a job or a fellowship somewhere outside India or even in India, I have a better chance of securing the same. And it is as I already told, it is a benchmark for ophthalmic knowledge and skills. So another thing is, so when we pass the FICO examination, it basically gives 3 grades. It's either just pass or passing with distinction or merit, which is above a certain percentile. So if you pass with the distinction or merit, it further increases the distinction. And also FICO serves as a lateral route or provides lateral entry into FRCS Glasgow. So if I've cleared the standard examinations, which is Part A, Part B, and Part C, I become eligible to directly give the final part of FRCS Glasgow. So it is conducted twice in a year. First session happens between March and April. Second session happens around October to November. The registration is online, opens few months before the exam, and however, the examination is offline and it is conducted on OMR sheets. So there are multiple centers throughout India. As of now, the website displays 16 centers. And for further information, you can log on to their website. However, for registration, they have a different website. So coming to the exam structure and passing. So passing is based on percentile and not percentage. It is MCQ based questions and there is no negative marking, and the results are usually released within 6 weeks. So Part A consists of 120 questions. The time allocated is 3 years. Basically consists of anatomy, biochemistry, microbiology, pathology related to ophthalmology, related to the eye. And Part B is optics, refractions, and instruments. Consists of 60 questions. Time allocated is 1.5 hours. Coming to Part C, which is clinical, it has 200 questions. Again, time allocated is 4 hours. So basically consists of all the clinically related ophthalmology questions, community health, and general medicine related to ophthalmology. Once the standard examinations are cleared, you become eligible for advanced, which consists of 115 questions, which have to be attempted in 3 hours. And it is very similar to Part C. However, it is in much more depth. So you can even withdraw from the exams if needed. So you have to do it before the registration closes. You can defer the exam for the next session or even get your money refunded. However, from that 100 Swiss francs will be deducted. So coming to my journey, so till now I have given part A, B, and C. I'll be appearing for the advanced in the coming April, the coming session. So I cleared part A and part B during the starting of my second year post graduation, when my basic sciences was still very fresh. Whereas part C I gave after my MS examinations, when I was thorough through my theory and my clinical knowledge. So it is a UK based exam. Because of that, you should always prefer UK based resources. So topics are not repeated. Questions are not repeated, but topics are repeated. For example, very commonly repeated question is the Prentice formula, decentration of prisms. So the same question might not, same topic is repeated again and again. So coming to how to part A. So books which I refer to, John, the second volume of BC, is all the first chapters of subspecialty volumes of AOBCSC series, which contain the basic sciences, the biochemistry, the anatomy, embryology, and so on. And then there is another book by Oxford, Basic Sciences for Ophthalmology, a UK-based book. iDocs is a question bank, to which I'll be explaining about in the upcoming slides. And obviously, past papers is an indispensable source. So what I did was I prepared retrospectively. So I referred to the question, solved the question, whatever the question was, whatever topic was asked, whatever the MCQs were, I went back and read topics from the particular books. So I prepared 2 to 4 months, allocated 3 to 4 hours daily for my preparation. And coming to part B is optics, instruments, and refraction. So Elkington is a very, very conceptual, and read it cover to cover 3 to 4 times, and definitely pass papers, and again iDocs. So 1 month is enough actually for refraction. We have a dedicated refraction posting at Arvind Eye Hospital, so my preparation coincided with that refraction posting. So it served both purposes. So again, as I told, I read these 3 to 4 times and 4 to 5 hours towards its preparation. So coming to iDocs, people who would have tomorrow or any other PG preparation source, it's very, very similar. So it gives you, it is also there for FRC Opt and FRCS, apart from FIC examinations. So it is online. You have the thing is, it is paid. So it roughly costs around 10,000 to 12,000 INR. You can get the subscription. So there is a series sets of MCQs, which is even specialty wise, and for basic sciences, it has been divided into part A and part B. So after solving the question, it tells you whether it's right or incorrect, incorrect, and also gives an explanation for the same. It also provides where you stand amongst your peers and provides the graph, the percentile, which is very helpful. And yeah, so I use this particular resource for both part A and part B in particular. So towards the end, I would like to thank all my people who supported me in my preparation, my friends, and obviously my seniors who guided me what sources to refer, and how much time I should allocate, how to prepare. So without them, it wouldn't have been possible. And success is no accident. It is hard work, perseverance, learning, and a lot of sacrifice. Most of all, you should love of what you are doing. Thank you. Thank you so much for giving me this opportunity. I hope it was helpful.
Thank you, Samir. Any questions anybody has, or we'll go to the next session, which is also the second part of FAQ, and then we'll take questions from the audience. Is that okay? Yeah. So let's go on to our next talk. Next talk is by Dr. Grisha Ravindran, who is currently working as a consultant of ophthalmology at ASD Vasan Eye Care, Trivandrum. She has done her MBBS from Medical College Trivandrum and MS from Lady Hardy Medical College, Delhi. Her long-term fellowship is in Medical Retina and UVA from Shankara Eye Hospital, Coimbatore, and short-term ROP from Dr. Anand Vinekar at NN Bangalore. She has cleared her FACO in April 2024. So she'll be talking to us on FACO, clinical and advanced. Over to you, Dr. Grisha. And share your screen. Yeah.
Good evening, everyone. I cleared my FICO advanced examination in April 2024. So I was hoping that I can share with you my take on how to prepare for clinical and advanced examinations. First of all, I thank KSOS and Young Ophthalmology Society of Kerala and India for giving me this platform. Okay, just briefly overview the ICO journey. You either give part A or part B or both of them together. So then once you clear both of them, you give part C or clinical ophthalmology. These three exams are together called standard examinations. Once you clear the standard examinations, you have two options. First option is to clear the advanced examination and get post-nominal FICO. Or the second option is to give FRCS Glasgow Part 3 straight and to get FRCS Glasgow. So coming to our main topic, clinical ophthalmology exam or the Part C. It is a 3-year exam consisting of 200 questions with 4 options with a single best answer. The good thing is that there is no negative marking. So make sure that you attend all the questions to increase your chance of clearing the exam. The questions are usually asked under these topics. So if you are running short of time, my opinion is to skip reading the theory for the last 2 topics that is marked. But usually you have to read both theory and practical for all these topics. If you are running short of time, you can skip reading the theory of the last 2 marked topics. So these are the types of MCQs that you can expect. So MCQs can be like this, lengthy MCQs depicting a clinical scenario, or it can be just a pictorial, it can be just an MCQ with a picture, or it can be a straightforward MCQ like this. So expect more of the first 2 types of MCQs in the advanced examination. Now, what to read for the Part C? The ICO recommended books are many. It is essential to read both theory and practical. For theory, you can read either of these theory books that you study during post-graduation like Kansky, C.R. Chowdhury ma'am's book, Yanoff and Duker, or AO Ophthalmology series. And for MCQ practicing, you can read review questions in ophthalmology by C. Chern and Seidel or Massachusetts Review Manual for Ophthalmology. For my preparation, I read Kansky's Ophthalmology and C. Chern and Seidel. Though we used to read most of these books during our ophthalmology PG days, that is theory books, but make sure that you are thorough with at least 1 theory book and 1 MCQ book for your FICU. Now coming to advanced examination. So it is an exam consisting of the questions would be 10 extended matching questions and 75 MCQs. Again, the good thing is there is no negative marking. The questions would be asked under these topics. So again, if you are running short of time, you can skip reading theory on the last 2 marked topics, but make sure that you practice MCQs on those. MCQs would be available on the MCQ books that I have already mentioned for these topics. So this is an example of extended matching questions. So extended matching questions are nothing but a compilation of different MCQs with more toughness and which are also related. So here is another extended matching questions on Xeroderma pigmentosa. So for each of the question that are asked, you would have to select the appropriate answer from each of these rows that are given. So again, what to read for the advanced examination? The books that are recommended are same as that of Part C, but for my exam, I gave more importance to American Academy of Ophthalmology than Kansky. Now coming to the exam fees, like most of the international exam, the downside of FICO is that it's high application fees. So you can see that every exam, the exam fees is coming in multiples of 10,000s. So altogether, we are looking at a sum of 1.8 lakhs. So my tip is to give Part A and Part B together. You can save at least like 20,000 rupees with that. Another downside is that FICO is not a licensing exam. So clearing FICO doesn't guarantee us the license to practice in any of the countries. So be sure about why you have to give FICO exam. So this slide has a lot of overlapping topic with what Dr. Samir has mentioned. So my first why was FICO adds to my curriculum. So it is an internationally recognized post-acronymal degree that I can add to my CV, which improves the career opportunities. So it is also a recognized degree among your peers as well as the patients. The second great reason is it is a gateway to FRCS Glasgow exam. So as Dr. Samir has mentioned, if you are passing the standard examinations, that is Part A, B, and C, you can straight away give the oral and OSCE part of FRCS Glasgow. So it exempts us from appearing for any MCQ part of the FRCS Glasgow exam. And the third reason is getting ICO international fellowships. In the site of International Council of Ophthalmology, it is clearly mentioned that it is recommended that you sit for one or more of ICO exams and clear it before applying for the ICO fellowships. But technically, it is possible to apply and get international fellowships in ICO without clearing these exams also. But I hope that clearing ICO exams give us an advantage for getting selected for the ICO fellowship. And the last reason is that some of us have the joy of giving exams, systematically testing us and challenging us for reading our subjects. Now, the ideal time for giving the exam. So Part A and Part B, it is recommended that you give at the end of your first year so that you would be thorough with your basic sciences and optics. And the clinical ophthalmology or Part C at the end of your PG, when you must have read all of your theory books. And advanced exam after 1 year of senior residency or fellowship, when you have a practical approach to the subject also. So 3 to 4 hours of focused study for 3 to 4 months would be enough for cracking each and every part of these FICO. So once you have made up your mind for writing the FICO exam, select your dates. So ICO exams are held twice a year in April and October. So next ICO examination date is 28th April 2025. And the payment and registration deadline is 24th January 2025. To always refer to their website also, because the change in dates are not uncommon with FICO. If you have any queries, you can mail them. Usually they are very responsive to mails. So summarizing my presentation, so don't go on reading just theory. Practicing MCQs are very important. And like any competitive exam, revision is a key, because you would be confused between two options. So it is very important that you know things. So revision is the key. And to save your effort, time, and money, give part A and part B together if you are well prepared. And manage time well during exam, because the questions can get lengthy and there can be a waste of time unnecessary. Thank you and all the best for the exams.
Thank you, Dr. Grisha. It was a very nice, concise, and very useful talk. So now I would like to ask Dr. Devendra sir, so what's your view on this FACU exam, and what's the real life scenario and the need for this exam nowadays?
Yeah, so the
Grisha,
ICO,
Hmm.
so the ICO exam still has its place even today, and it is an attempt to standardize the kind of ophthalmic training and teaching and examinations around the world, which is a very difficult thing to do, because even in India there is so much of a difference between the kinds of examinations people appear for, different centers, different degrees, diplomas, etc. So it does give you some sort of parity with other candidates who have passed around the world. I think the biggest advantage is the ICO fellowship route, because you can avail of very good fellowships, which are, to be very honest, observerships in most cases, but they do open your eyes and open your mind to a different way of working in a foreign country. And you can really use that fellowship to develop contacts and network with people around the world. So that's a very valuable route, or very valuable added benefit that the ICO examinations gives you, which the FRCS, for example, does not offer. There are differences between the two examinations, and I think that's important to recognize, and also play each examination to its advantages.
Okay, Dr. Samir, you'll be preparing for the advanced exam now, right? You've cleared up
Yes,
to.
ma'am.
Okay, so nowadays I've heard that previously there used to be so many Telegram groups wherein you can study together for the advanced exams now, but the ICU has become very strict with the sharing of previous papers. Nowadays, nobody is able to find any of the previous question papers, so you don't have any idea of how the questions are. Also, I've heard that recently they have changed the pattern also. It's really difficult nowadays to crack the advanced one. And so what is your take? Have you found any Telegram groups or any helpful societies which is helping with the preparation of advanced ICO?
So actually, for me, like most of the time, my seniors and my peers have been very helpful. I'm not sure about the Telegram groups right now. I'm not very active in those. But I got the past papers through my batchmate actually. So I think she got through Telegram groups, and I think it's not like completely updated, like till 2024, not like that, but probably till 2022. I think the last paper is what I have. So as a, like you don't get usually, it's not very fresh unless and until you're very lucky. Like for example, 2024 October session, it's difficult to get that one. But yeah, probably in a gap of 1 or 2 years, you might be able to get the past papers. Telegram actually has a lot of ophthalmology groups. Uh, so not just the papers, but the books as well. I think if you search a bit, you will be able to get it. And I got the past papers through my friends only. So they just shared with me.
So
So
Dr. Grisha,
if needed, anyone can actually contact me. I'm more than happy to share the past papers.
thank you, Samir. So Dr. Grisha, so did you find that there was any difference in the question pattern compared to the 2022 papers and the one that you have written? Was there any difference?
Questions were very lengthy, ma'am, I felt.
Okay.
And the external matching questions, you really have to think.
So you'll have to practice a lot.
Yeah, there would be like close match between two clinical scenarios, and it's very easy to confuse if you don't read carefully. So what I did was, my weak point was pediatric ophthalmology. So I put it at second last so that I don't waste much time in that, and I don't panic when I have to tackle a difficult topic at the last. So I kept it at second last. So all those things I finished very fast.
Okay. So were you able to
Anna-
find any past question papers?
In Telegram ophthalmology groups, it is there. Some compilation of it is usually like compilation of cornea, compilation of retina, separate for each subjects. It is there. If anybody is contacting me, I can give.
Okay. So
Another thing, what I just want to add one thing. What I felt from my past experience was like since I gave Part C recently, so I felt like the lot of questions were actually very ambiguous. Like although you would have read the topic, but you'll get very confused between two options. So I still remember there was a question about Behcet syndrome. So I was able very easily I ruled out two options. So there was one option which asked that blindness occurs in almost 50% of the patients, and another a question was panuveitis is the most common presentation. So you know it causes panuveitis, it causes non-granulomatous uveitis. You also know that it has the potential to cause blindness, but you might skip the percentage part, that how much percentage it's causing blindness, or whether panuveitis is whether the most common presentation or not. So I would suggest you have to pay attention to these nitty-gritty details to rule out ambiguity in few questions at least.
okay. So let's move on to our next topic, which is FRCS. So Dr. Grisha, can you unshare your screen? Okay. So moving on, we are moving on to the next exam, which is the FRCS exam. So Dr. Chaitanya Avarial, who she'll be talking to us on FRCS Part 1 and 2 preparation. She has done as MS Ophthalmology from RIO Trivandrum, Fellowship in Pediatric Ophthalmology and Adult Strabismus from Arvind Eye Care, Tirunelveli. And she also holds FRCS, and she is currently consultant pediatric ophthalmologist and strabismologist at Chaitanya Eye Care Hospital, Haripad, Tiruvalla, and Kottayam. Her areas of interest are in complex strabismus cases, visual rehabilitation in special children, and in binocular vision management. Over to you, Dr. Chaitanya.
Thank you, Dr. Raki. I would like to thank KSOS and Young Ophthalmic Society of India to have me in this talk and for this wonderful opportunity. Here I am going to talk regarding what is the importance of FRCS and how to confidently prepare for Part 1 and Part 2 FRCS.
Can you go screen mode? Full screen. Slideshow mode.
Slideshow.
Yeah.
Yeah, previous years we have seen ophthalmology as a specialty with very limited job opportunities because of the very number of years for surgical training and costly experience. So the role of international exams is here. Many international exams are there. And basically, FRCS is offered by 4 different colleges. Before going for any international exam, you should need a proper motive for what you are going for this international exam. It can be for your additional degree or postdoc, or you are an exam interested person to clear new exam, or for job prospects to settle abroad. What is your plan? Anything is your plan. Always plan according to your needs and not by looking at peers, because this is a costly exam and time consuming. And importance of FRCS is a recognition and prestige. It gives you improved career opportunities and international mobility. As you're preparing for a prestigious and very clear cut exams, Your clinical skills and the improved patient care is it is getting enhanced. So, before preparing for any international exams, you should have a clear roadmap. And also, the most common question is when to start the exam. The sooner, the better will be the answer from me. Can start even at the end of the first year of residency or the beginning of the second year of residency will be the best time to clear the initial parts of all these exams. So just to have a comparison between FICO and FRCS, both a three-part exam, and all the FICO exams are basically MCQ, and FRCS, the initial two parts will be compared to the FICO part A, B, and C, and the third one is basically clinical and OSCE exam. I will be dealing with the FRCS part 1 and part 2. Just what is the importance till up to FICO part 2? You can get an MRCS Edinburgh, just a degree, and can also go directly for the FRCS Glasgow exam. If you clear the advanced ICO after ICO part C, can appear for the FRCS Edinburgh also. When you just compare between FICO and FRCS, FICO is basically for a post-nominal and for your fellowship, international fellowship opportunity. But FRCS can bypass the flap. GNC registration is possible with FRCS only, not with FICO. Can practice at many countries and better remuneration at the Middle East. So, for exam practice, you need an insight into the exam structure, study strategies to be maintained with the help of your friends or mentors, develop communication skill that is very important for the OSCE and clinical exam. Time management technique is very important for initial two parts and especially for the part 3. Seek a mentor and strive to be a better clinician. Always the second part and the third part you will be appearing during your work when you are working. So you need to balance your study and work. Coming to the FRCS part 1, part 2, and part 3 is already a clinical exam. And eligibility criteria for part 1 is you need to pass MBBS with 1 year internship and also 1 year clinical experience in any subspecialty, in any specialty. For part 2 eligibilities, you need to clear the part 1 FRCS or other exemptions for part 2, that is part 1 ICU exam. And 5 years of clinical experience after internship is needed. For that, 54 months, that is 4.5 years, should be in the ophthalmology. And for part 3, you need to clear either part 2 FRCS or part 2 ICU. Coming to the part 1 FRCS, it's basically MCQ questions. The topics will be covered under basic science, optics, and refraction, almost similar to the part A and B of ICU. But here 160 MCQ questions are there. 2 hours duration is the exam time, and it is held online twice a year. Topics are almost same as compared to the ICU, anatomy, embryology, up to the genetics will be there. And when you compare ICU part 1, A and B with FRCS Glasgow 1, number of questions is 20 number more in the ICU, and the option, you need to choose an answer from 4 options in ICU and from 5 options in FRCS. Duration of exam time is more in ICU and 2 hours for the FRCS. Is almost comparable. Part 2 FRCS is also MCQ. Here, the questions is from clinical specialties. Here, the medicine and neurology questions, few questions are also added. Here, the MCQ number is 180 MCQs. Time duration is 2.5 hours. Held twice a year. When compared between ICU Part C and FRCS, 20 number most questions is more in ICU. Options to choose will be 4 in ICU question and 5 in FRCS. Fee is almost comparable. This is just an example of an ICU question. Options will be 4. You need to choose an answer from the 4 options. But for the FRCS, you need to choose from 5 options, and the time duration is also less, 2.5 hours. There are so many online sources available for the practice of this exam. One, as already Dr. Samir said regarding the FICO, Same, another for the FRCS and FICO is IQ questions. Premium, paid, and basic fee are available. Duke Elder revision questions is also there. For part 2 also, clinical ophthalmology, same thing is there. Chua website is very useful for your preparation for your part 3 FRCS. And you need to refer Kamsky, American Academy of Ophthalmology, and MCQ books. And tips to clear the exam. You need adequate preparation. Almost 2 to 3 hours a month, 2 to 3 hours per day for 3 to 4 months. For part 1 and part 2 based on your subject knowledge. And how to act on the day of exams is very important. Be over prepared. For either part 1 and part 2, it is online. You get on the server early and ensure proper internet connection. And for part 3, you plan your route beforehand and get there early. Always the dates and places will be almost similar to every year. Very, very minimal changes will be there. So plan ahead and prepare adequately. And wearing appropriate outfit is very important. Answer all questions because there is no negative marking for the MCQ question. If there is a difficult question, return to the questions later. Manage your time because 2.5 hours for the part 2 and 2 hours for the part 1 paper. And read questions carefully. Keep calm and collected. You can clear your exam. Thank you.
Thanks a lot, Dr. Chaitanya. So she has comprehensively covered everything on FACS part 1 and 2. So I would like to ask Dr. Devendra sir, would you like to add anything on this preparation of the first part?
No, it's a comprehensive talk that she has given. So, part 1 for both the exams, which is basically your basic sciences and optics refraction, these are subjects that are given a little less importance in our routine postgraduate examinations. But, using these examinations as a sort of insurance policy that you study these topics is very useful. And, it will really help you in your practice as well. Even now, 15, 20 years into practice, I remember the topics of optics and refraction I had studied for the ICO examinations. So it's going to stay with you for the rest of your life because you've paid a lot of money to give those examinations. So you really value the knowledge you gain.
Okay. So let's move on to the second part of FRCS examination, and then we'll ask the questions from the audience. So our next part will be covered by Dr. Anne Teresa Anthony. She is a consultant phaco surgeon and medical retina specialist at Amita Eye Care, Tiruvalla. She has done her MBBS from Fathamulla Medical College, Mangalore, MS from Government TD Medical College, Alleppey, and long-term IOL fellowship from Amita Eye Care, Tiruvalla, and short-term fellowship in medical retina from Giridhara Institute, Cochin. She has cleared MRCS in 2023 and FRCS in 2024. So she is currently the treasurer of Ophthalmic Society of Pathanamthitta. Over to you, Dr. Anne. You can share your screen.
At the outset, I would like to thank Yossi and KSOS for this opportunity. Over the next few minutes, I'll outline the study materials, the study strategies, and the insights into the exam structure of FRCS Glasgow. So the routes to FRCS Part 3 is either you can go through the FRCS route by clearing Part 1 and 2 of FRCS, or if you clear till FICO clinicals, you can write FRCS Part 3. The exam is usually conducted 3 times a year in India. And the main stress factor for this exam is the fee structure itself. The recent fees was about 1,725 pounds, which is nearly about 1,84,000 Indian rupees. So it's always better to give exam as early as possible because every year they are making a 10% increase in the exam fees. So how to apply for Part 3? Visit the Royal College website, navigate to part 3, register your interest. Once you get the seat confirmation, upload the following documents. And once you upload the following documents, you will get the link to pay the fees to your login ID. Next, coming to the study materials required. Kensky latest edition is the base book for your preparation. It's like your Bible. Read every page, every word, every line. And be familiar with all the pictures of Kensky because the same scenario you may get in your Viva day. And don't neglect the small chapters like conjunctiva, sclera, tumors, dry eye, because a lot of questions will be asked during the Viva from these areas. And if you're thorough with your Kensky, it's very difficult to fail in this exam. Reading previous candidate experience is really mandatory. Go through at least 5 years of past candidate experience. The same scenario may get repeated for your exam. Even though Kensky is the base book, but this book, Practical Guide to Viva and OSCE in Ophthalmology by Wong, is a wonderful book. I will say it's a must-read book because it has helped me a lot during the preparation, and a lot of scenarios, the same scenarios are repeated in the Viva. FRCS Cakewalk is a mandatory book for your preparation, and the preferred method for the clinical examination is given in the initial chapters of this book. Oxford Handbook of Ophthalmology is really useful for revision at the last minute. It's like a mini Kensky. Everything, the treatment and the guidelines, everything is given in a nutshell. Joining Professor Muthuswamy Telegram group is really useful during the preparation. You can join the group by dropping a mail to Professor Muthuswamy. And there are a lot of volunteers in this group who conduct mock exam. And these are really helpful for your final exam. This book, Viva and OSCE by Timothy, is a good reference book. And the treatment part is given according to the UK NICE guidelines. The ability of the candidate to manage the common emergencies is assessed in this exam. So focus on emergency medicine during the last month of your preparation and try to get help from a person who is trained in emergency medicine so that he can help you in answering the ABCD, the preferred method of ABCD approach. So these are the common emergency questions that is asked during the FRCS Glasgow exam. You can watch the reference video from the CHUA MRCS website. There are good reference video of pupil ocular modality 6-nerve, 3rd-nerve examination given in this website. You can also avail the online courses like iCourses, but the disadvantage is you have to pay a significant amount of money to subscribe it. Next, coming to the study strategies. When you are planning something great, have proper plan and work on it step by step. 6 months of targeted preparation is needed at least. Start with your Kensky and previous candidate experience. By the time you will be writing FRCS Part 3, you will be practicing as consultant in some subspecialty. So in order to brush up other areas, start seeing the general OPD cases. And always try to get a study partner because encouragement from the partner can keep you motivated in the track. And keep the last 2 months for thorough revision and the final week for quick revision of all the topics. The most challenging part is balancing the studies work-life balance. The chances are high that you will be very busy with your work. So clearly set boundaries and clearly define when you will work, when you will spend time with family, when you will study. Practice, practice, practice. This is the key to success. Because you will be having a lot of subject knowledge, but how to comprehend these facts and answer in a nutshell, you need a lot of practice. Review the cases that you see in OPD and discuss with your colleagues. Improve your communication skills. Learn to answer quickly and clearly. Coming to the exam structure, the part 3 is conducted in 2 days. The first day is the Viva day. In the Viva day, you have to go to 3 tables and each table consists of 20 minutes. It's like a rapid fire sort of examination. There will be 2 examiners and 1 examiner will be asking you question and the second examiner will be assessing you and putting marks. These examiners will be looking for certain keywords while you are answering. And the most important thing you have to remember is you have to describe the findings in a systematic order, and always remember to say the common differential diagnosis first. You will get an off day between the Viva and clinicals. Utilize that day maximum. Practice with your study partners in a common destination during that day. In the clinical examination, you have to go to 4 tables, 4 stations, and each station consists of 12 minutes, and there will be 2 examiners. You will get a minimum of 2 and maximum of 4 patients in each station. Time, speed, presence of mind. These 3 are very crucial for your success. Speed is required to see more number of patients. Presence of mind is really crucial for your success. And if you have done bad in one station, forget about it and focus in the next station. And the reasons for failure are missing an important clinical sign, not knowing at least a differential diagnosis, or doing a fatal mistake. Knowledge and experience is with everyone, but who manages the anxiety at that moment comes out as winner. So my take-home message is have a proper study plan, practice regularly the clinical examination technique, be thorough with your Kansky, and stress management during exam is really important. So if you have any query regarding the part 3 preparation, you can mail me. Thank you.
Thank you, Dr. Anne. That was again a wonderful talk. So I think now we'll have the audience questions. There are so many audience questions that has come from the YouTube as well as from the Zoom. So many of them were asking, like, is there any age limit for writing FRCS? Like, some people have given the first part back 10 years back, and now they want to complete it. So is there any age limit for writing the FRCS exam? Dr. Chaitanya?
There is no age limit as for eligibility criteria. They are same as already I discussed what are the eligibility criteria. And another one is number of attempts. Maximum number of attempts revised during 2014 is 6 attempts. Age, there is as such age, there is no criteria.
And regarding the gap, is there any issue with the gap also?
That's also not anything mentioned in their website. Only they are mentioned regarding the eligibility criteria and regarding the number of attempts. 6 attempts is the maximum attempt, and 1 more attempt after the request. If you fail during 6 attempts, maximum 1 more attempt based on the chance. Otherwise, no possibility. Duration, they are not mentioning anything.
So even if they have given 10 years back also, they can try attempting now, right? Dr.
Yeah,
Devendra?
they can apply.
Yeah, I agree with Dr. Chaitanya. Nothing is explicitly mentioned on the website as to any gap between the examinations, but it's always advisable to mail in advance before filling up the application form and ask if you have appeared in this year and cleared in this year. Will this be held valid for appearing for the next part? Generally, they will require your old documentation in the form of the certificate of your previous examination, having passed the examination when you apply. So those doubts will automatically be cleared up during the process of application.
And one more thing to add, during this long gap, the exam structure may get changed. Till up to 2021, there was part A and part B for the second FRCS. From 2021 onwards, only MCQ related. So during long gap, the exam pattern may change. That's the one thing. Otherwise, you can ask Sir that it is better to get mail and get a reply and access.
Okay. And one more thing, now I think the FIC has stopped their collaboration with the FRCS Edinburgh. Now we are eligible only for FRCS Glasgow. So a few people were asking, like, is there any real difference between this FRCS Glasgow and Edinburgh as such?
So there is no tangible difference. Both of them exempt you from PLAB if you are appearing for, if you are planning to migrate to the UK. They are both PLAB exemptions. FRCS the Royal College of Surgeons of Edinburgh has the examinations are extremely infrequent and they are predominantly held in Edinburgh itself. Now there is, just today I got some news that they are planning to restart examinations in India again after a long break. So you may have to watch out for those. The more accessible and easy to do examination from just sheer logistic point of view is Glasgow, and there's really no tangible difference between the two in terms of benefits.
Okay. And sir, regarding that, I have also heard about this one-day practical session which is being held at Lakshmi Institute. So how to apply for that and what are the prerequisites?
Sure. I'll just do a screen share later during the program, with the number and the contact details, so anybody can just take a screenshot. We have this course generally once a year towards the end of the year when the practical examinations are held in India. So we generally have it in August or September, generally 20 days before the actual practicals begin. And it's a 2-day course. We do some didactics on the first day, and then we have our table vivas and the clinical patients. Dr. Ann had a really good presentation because I think she stressed very importantly as to how the examination is a little different from all our Indian examinations. We are very good with the theory, but when we have to appear for a practical examination, the DNB and MS examinations are totally different because you spend half an hour with the patient on your own, alone, see the patient, from the examination from back to front, and you really can discuss with the patient. Many times the patients or the invigilators may give you clues and the diagnosis as well. Here, everything is done in front of the examiner and you have hardly a few minutes to do your examination. So it's a very different kind of pattern. So you really need to train and practice and ideally have a study partner who you can discuss with and be very fluent with your examination. It's a totally different mindset that you need to apply.
So you have been training these people for this FRCS exam. So in your experience, what are the reasons for this failure, especially when it comes to practical exams?
Yeah, so the predominant thing is that it's very different from what we are used to. That's because across India, the DNB, MS, diploma, these kind of examinations are fairly standard. But the Royal College examination, you have to see many patients in a very short period of time. Actually, you have 12 minutes in which you have to see as many patients per station that you can. And as Dr. Ann said, presence of mind is very important because a lot of things are obvious, but you may just in the heat of the moment, you may not be able to pick out what the case is all about, which may not be held against you per se, but the examiner is always there to help you. It's not very, I will say, it's not very difficult to pass the examination because if you are fairly well read and if you have some clinical experience, this is why the examinations are not, the ideal time is not immediately after MS. You may not be able to give it also because you need that many years of training. But ideally, it is a consultant level examination. So you should be post-fellowship or be into practice when you give the third part. That really makes you a little more confident of your findings and your way of answering.
So we have Dr. Prashop here. He's currently working as a consultant in UK.
Sorry, Dr. Raki, I can just, I'll just quickly just share this. Anybody can just take a screenshot of this. This is our contact details. So, we have this course and you can just take down the details and we can be in touch over mail or phone.
Thank you, sir. So, Dr. Prashop, so you are also holding FRCS. So what is the real life scenario of holding FRCS and practicing in UK?
Thank you for inviting me to this webinar. It's been quite a long time since I've appeared on a KSOS webinar. This used to be 3 years back. Every Sunday used to be in front of a computer. Now been a long 2 years. Thank you, KSOS and Yoke and USC opportunity. So practical scenarios of FRCS and FRC Opht. If you want to move to the UK, and if you would like to progress to a consultant, then the better exam would be FRC Opht. Because if you the only way to progress to being a consultant in the UK as of now is to go through a pathway known as portfolio pathway, previously known as CESR or CSER, where you do a lot of paperwork and you submit your evidence to show that you are similar to that of a UK trained candidate. Before you could get into the training, they call post-graduation training in the UK. So you could get into ophthalmology training in the third year. The training program is 7 years in the UK. So you could get into the training program from the third year if you had a lot of qualifications. But now that pathway, for now at least, has been closed. So, and you're overqualified to enter into in the first year because you already have 3 years of training, in India where you have passed MS. So the only pathway would be a portfolio pathway or the formerly called CSER pathway. And in that pathway, FRCS is not counted at all. If you want to get into become a consultant using FRCS Glasgow, you will have a mountain of evidence to submit. Practically, the Royal College of Ophthalmologists has designed the portfolio pathway in such a way that you have to give FRCS. Theoretically, it is possible, but practically, you need to give FRCS as a first step if you want to progress to a consultant job. But if you are happy to remain in other grades, there are different grades of ophthalmology practice in the UK. You can remain as a specialty doctor. You can go up to the level of associate specialist or specialist, but you cannot become a substantive consultant. You can become a locum consultant. A locum consultant is nothing but your contract needs to get renewed every so few months or years or so, that you don't get a substantive post, that you don't get a permanent consultant role in the NHS. If you're not on the specialist register, to get on the specialist register, you have to get through the portfolio pathway. So FRCS Glasgow, in that sense, will be good if you're happy with staying at the specialty doctor or associate specialist or locum consultant. If you want to become a substantive consultant, FRCS, you need to give it. That would be the better pathway. I mean, there are a lot of people who have given FRCS, come to the UK, and during their tenure here have appeared for the FRCS and have passed. A lot of people have done that. That is also possible. But if you can give FRCS in the first go, then you don't need to give FRCS.
Okay. So now our next talk is mainly on FRCS. I'll be introducing the speakers first. So Dr. Pranita Sahai was going to talk on FRCS, but she's unable to join. So she has sent me a recorded video. She has done her MD from AIMS, FRCS. She holds FRCS, FRCS and FACO and phaco-refractive surgery. She's an assistant professor at GNAC, Maulana Azad Medical College, New Delhi. She's the executive member of Delhi Ophthalmic Society and ex-faculty of LHMC, UCMS, and CFS, New Delhi. She has published 91 index publications, authored 1 book and greater than 30 book chapters. So she'll be talking to us on how she prepared her FRCS. So I'll be sharing her video, recorded presentation.
Good evening, everyone. At the outset, I would like to thank UC for giving me this opportunity to present on this topic. Hope I do justice the same. So I'll be talking about how I prepared for training remains incomplete. The international exams for certification are like ICO, FRCS, FRCOFT, and grants can be applied for these fellowship. However, if you're looking for overseas registration, FRCS and FRCOFT is something which is important. For job opportunities in the Middle East, FRCS holders get better remuneration. Hence, if you're looking for better job opportunities, this is a good option for you. For higher educational qualification, FRCS and FRCOFT are considered in faculty interviews, especially the UPSC. There are various other advantages of these exams. For example, you become entitled to become an examiner for the FRC of certain journals like the I give you a full access to their publications if you have this degree to your name. Also, you have access to the American Academy of Ophthalmology One Network and the annual Congress of the RCOs at reduced fees. And always there is a joy of using these postnomials and joy of clearing these exams, which remains a motivation for appearing for these exams for a lot of students. So coming to the main topic, that is FRC of exams. This is the official website on which you can find all the detailed information regarding these exams, the exam schedule, the pattern of exams, the fee structure, the available dates, and what to read in the syllabus, etc. So the FRC of the examination is conducted by the Royal College of Ophthalmologists in London. It has 4 examination steps, and if you are successful, you become a fellow of this society. For the FRC of postnominal, successful candidates also need to become a member by applying a membership fees. This is an exit exam for the ophthalmology trainees in the GMC. Hence, you become equivalent to the students in UK who are studying ophthalmology if you clear this exam. This is the exam structure. The part 1 is a written exam which covers the basic and clinical sciences. Part 2 has a written and a refraction certificate for which is quite costly. For written, the minimum of ophthalmic training that's required. However, for part 2 written or for the written, you need a minimum of 4 years of ophthalmology training. So there is no fixed pattern. You can go from part 1 to the part 2 written or the refraction certificate followed by written here for the oral. So it is important that there are no exemptions, unlike FRCS, for which you get exemptions if you have cleared your ICU exams. You do not get exemptions of FRCS, Glasgow, or ICU exams even if you cleared them. So the earlier that you decide in your residency, the better it is to exam this exam. You need to know your syllabus, you need to plan in length, because not only these exams tests are exhaustive, they are also expensive to clear. So once you decide to appear for this, you really don't want to fail any of these steps. The part 1, we already talked about. Important is it's an online proctored exam, so you do not need to go to UK for this exams. You have 2 set of MCQ papers, 2 hours each for this exam. This is the syllabus that you need to read through before you appear for this exam. And what I read for this exam was the clinical optics Elkington for this part, and the clinical anatomy of Khurana is what we all read in India. But Snell's anatomy is also something which is helpful, as well as Adler's physiology. And AO, basic and clinical sciences, is very useful. The refraction certificate, this is a practical examination which is based on practical examination for your clinical refractions. It has 10 stations of OSCE in which you are supposed to perform retinoscopy, simulated retinoscopy, non-strategic retinoscopy, subjective refraction, both cylinder and sphere refinement, as well as binocular balancing, and lens neutralization test, which can be done even with lens or a focimeter. Not automated focimeter, but the manual focimeter is something which is kept on the stations, and you need to be well versed for using this equipment in the exam. When to appear? Again, there is no minimum training required to appear for the exam, and you're unlikely to pass the exam unless you have done extensive practice. For me, I started to prepare for the exam and did around 60 to 70 refractions, following all the steps, all the basic steps, right from retinoscopy to refinement of sphere and binocular balancing, to be and to be able to master the art of refraction. Be quick, because in exam every station has 5-minute time. So you not just need to be perfect in refraction, but also be very swift and fast in performing the various steps. So these are the various sources from which you can read about retinoscopy and refractions. Now, other than the refraction, you're also assessed upon various aspects. For example, assessment of vision, assessment of motility, the hand hygiene with which you are approaching the patient, the rapport, your communication with the patient, how do you explain the various steps of what are you going to do in the examination part is also something on which the students are marked upon by the examiner. And as I already told you, time management is very important in this practical refraction exams. Coming to the part 2 written exam, again it's an online proctored exam, so the advantage being that you do not need to travel to UK or any other center abroad. You can appear for these steps in India itself. It has 2 MCQ papers of 2 hours each with 90 questions in each paper. It is basically a theoretical paper and covers the entire subject of ophthalmology, and you need a minimum 4 years of ophthalmology training and a cleared part 1 examination to be able to appear for this step. The best time to appear for this exam is immediately after the end of your post-graduation, maybe at the end of your first year of senior residency or fellowship, because your entire subject of ophthalmology is afresh and you do not need to put a lot of effort when you're applying for this step. So other than what we all read, for example, what we read in our MD exams or PG exams, health promotion and disease prevention, continuing professional and personal development is something that you need to read about. NICE guidelines and the NHS UK has a specific set of standards of ophthalmic practice that you need to read about in the NHS website, where all the data is available, which are often asked about. For example, the driving license criteria for visual acuity, their own criteria for management of CNVN. So everything is mentioned in detail. They have their own protocols of managing each and every condition, which are given very well in the NICE guidelines, which you can refer to on the NHS website. Now, we have already covered this. So coming to the part 2 Viva, that is the OSCE. So the OSCE, you have 2 parts. You have the structured Viva and the OSCE. There are 5 stations in the structured Viva, wherein patient investigation and data interpretation, patient management, attitude, ethics and responsibilities, audit, research and responsibilities, and health promotion and disease prevention is something on which you are assessed. And in the OSCE, the various stations are related to anterior segment, glaucoma and lid, posterior segment, strabismus and orbit, neuro-ophthalmology and communication skills. In each station, you have 1 patient and 2 videos. Communication skills is a very important station, which is different from all the other exams like FRCS and FICO. Herein, you may have a patient who is agitated or depressed or very worried about his condition, about which he has just been informed, and you need to console this patient and communicate about his clinical condition and console him in the best possible way. And on the basis of your communication skills, you are judged and assessed by the examiner. So you have a simulated patient in this station. So tips for the part 2 exam is that you need to prepare at least 3 months in advance and read the basic textbook, at least Kansky and Oxford Handbook. Oxford Handbook is very helpful. And the non-clinical topics, the Oxford Manual of Training in Ophthalmology can be read about. And the RCO guidelines and the current GMC Good Medical Practice Guidelines are again important even for the practical exams. The ophthalmic investigations also need to be read about. The MCQ book for the FRCO by Darren Hunting and David Steele can be helpful, and by Timothy Fung and the Winfried Amakwe, the Viva and OSCE book can also be referred to for improving your skills in these exams. Now, the pass criteria varies from 30 to 80%. Hence, you need to be prepared well in advance. Various marking schemes like the Ebel and Hofstee are used in these exams. Now, there is a limit for attempts in each exams, each step. However, I'm sure you're not going to require so many steps to pass these exams, and you need to pass all the steps in 7 calendar years. As I already told you, these exams are very expensive. So all the 4 steps cost around 4 lakh rupees, and the cost keeps on increasing every year. Hence, you need to plan well in advance when you're appearing for these exams, because once you appear, you really don't want to fail in these exams because they are very expensive. Other than that, once you have passed these exams, you need to pay around 30,000 of annual subscription fees to maintain your post-nominal of FRC. So it's a long way. However, if you plan it well in advance, you will be able to cross these multiple steps without much effort. Prepare well in advance, and I'm sure you're going to be successful in these exams. So these are few of my degrees that I achieved after clearing these steps. And you always need a good study partner. For me, it was my husband with whom I prepared and appeared for these exams. And this is a photograph of my convocation ceremony that I attended with my daughter that when she was 1.5 years old. So it's never too late to appear for your exams, and you can always be successful if you prepare well in advance. With that, I would like to conclude. Thank you.
So that was a talk by Dr. Pranita. So as she has mentioned, this exam, FRC of has got so many steps and it's very costly. And the cost is also increasing per year. She was telling around 4 lakhs now, and it will keep on increasing also. So we have another talk on this FRC of itself in the real life scenario. So we'll move on to that talk and then we'll discuss. So our next talk is by Dr. Prashop Mohan. So he's currently working as a locum consultant with a special subspecialty interest in cornea at Northern Care Alliance NHS Foundation Trust and the Croft Shifa Healthcare, Rockdale, UK. He was a previous cornea, cataract and refractive surgeons at multiple tertiary level institutes at Kerala with an experience around 7 to 8 years. He has got a certificate of laser refractive surgery, fellowship of Royal College of Ophthalmologists, fellowship of Royal College of Surgeons, Glasgow, and he has also done his fellowship in cornea and external diseases from RIO Bangalore. He is a quiz wizard. He used to keep on getting all the quizzes, like quiz prizes at state level, national level, everywhere. He has published several research papers in PubMed Index journals, and he has authored 2 book chapters. So now over to Dr. Prashop. Let's hear from him what is a real life scenario of all these international exams, especially FRCS and FRC of that, and in going abroad.
Thank you, Raki. That was a very kind of you, really kind introduction. And thanks, Raki. Thanks, KSOS. Thanks, Yok and Yosi, for this opportunity. Nice to catch up after such a long time. So I'll be talking on some of the practical implications and what are the real world scenarios. Having gone through all the hoops myself, I have some views on this. First of all, a disclaimer. The views are personal and they may not apply to everyone. And no one needs to extrapolate this. No one needs to come and fight with me. We can have cordial discussions. I'm not an exam enthusiast, even though I've written all these exams. It was out of majburi, or there was no choice. Because my wife was going to the UK, I needed to go to the UK as soon as possible. I needed to get the registration. So I wrote whatever exam that came my way. That's the reason I have both FRCS and FRC off, because I was just writing the first exam that was on the schedule. And I don't believe exams measure anyone's aptitude or skills. I think it is an outdated way of measuring someone. I don't believe this. Most people know in their heart of hearts that it's nonsense, but this is the world we live in. We have to do these things. And some of my views are in contradiction with even the other speakers. I apologize for that. But as I said, these are my personal views. Now, what is FRC of? It is the Fellowship of the Royal College of Ophthalmologists. And I see that.
Have you shared?
Have you seen my screen?
No. Have you shared your PPT?
Yeah, it's visible to us.
I'm sharing this.
Okay. Not visible to me.
Okay, so FRC of is the Fellowship of the Royal College of Ophthalmologists. There is only one Royal College of Ophthalmologists. And it's headquartered in London. I see many people writing FRC of London bracket. There's no need to write that. Write FRC of. There are many misconceptions about FRC of. One is that passing FRC of will make me a consultant in the UK or the GCC countries, which is false. It does not make you equivalent to UK training. So UK, it is one of the exit exams for UK training, yes, but there is a difference between being a UK trainee and passing the exam. So you don't get all the privileges that a UK trainee gets if you pass the exam. So I have to disagree with one of the previous speakers. It does not make you equivalent to the UK trainee. GCC countries also, you don't get automatically anything. You just pass FRC of course. Having FRCS or FRC off is considered better, and you may do better in job interviews. Then there are people who think that they can practice in Canada, Australia, New Zealand with FRC off. That is not true again. The word fellowship is used very loosely. It has different meanings in different contexts. For example, the fellowship in cornea in India would mean that you've gone to some place and you trained in cornea for 1 or 2 years. Or a fellowship in vitreoretinal surgery would mean that exactly the same, but it wouldn't mean anything more. Now, FRC off is not a fellowship, as in you don't go and train somewhere. It is just a set of exams, a number of exams that you pass, and you pay a membership fee, and you're considered a fellow of the college. That is what fellowship means. It is not similar to the FRANSCO, that is a fellowship of the Royal Colleges of the Australian and New Zealand College of Ophthalmology, where that fellowship is not awarded just after an exam. Again, it is awarded at the end of your whole period of training. There are other ways to get FRANSCO as well. There is another assessment pathway in which you can get FRANSCO, but it is not equivalent to FRC. FRC just means that you pass the exams and you pay the membership fee. That is all. It does give you ability to register with the GMC. There are 2 levels of registration in the GMC. One is full registration, the other is specialist registration. You do not get specialist registration just by the virtue of FRC off or FRCS. You get only full registration, and you need to pass through a lot of other hoops to get specialist registration. Another misconception is that it's too tough an exam and can only be passed by the top rankers. That's not true. It is, yes, it is more grueling, more tougher than the FRCS exam, but it is not impossible to pass. It can be passed with the right mix of luck, effort, and a lot of other things. So my suggestion to people who are thinking about writing this exam is that you should define your goals first. Find out where you are, what your long-term plans are. Do you want to fly abroad? You want to settle in the UK? Then I say go for it. This should be your primary goal if you want to become a consultant in the UK. However, if you're happy with just being a specialist, I mean, I don't mean to demean anyone who is a specialist or a specialty doctor, but there are some privileges that in the UK that you get when you become a substantive consultant, especially with regards to private practice. So if you're willing to forego those privileges, then there's nothing wrong in it. You can still go for FRCS only and not write FRC. You have to be sure where in the world you are going to settle. That can influence your decision to write FRCF or not, because it is not just an expensive procedure. It's also takes a toll. It is also cumbersome. Again, in the GCC countries, I think it is considered favorable in interviews, but it does not give you any automatic entitlement. Always discuss with your family where you're going to settle, what your spouse is going to do. Have that discussion, where you want your children to grow up. So some people say separate your personal life from the family. It is not possible to separate the personal life. Personal life is your professional life. and you can't live in one country and work in another country. So they have to go hand in hand. And some people are fond of the British passport. If you are, then I think it is ideal for you to. Okay, and if you want to become a consultant. Advantages of the exam are you get GMC registration, you get full GMC registration. In addition, you also have to pass the English language exams, they are OET and IELTS, just like FRCS. It is a mandatory step, as I've explained before, practically. Theoretically, it is not mandatory, but practically it is mandatory to become a substantive consultant. Now, substantive consultant is someone who gets a permanent consultant position in the UK. Of course, there are exceptions where some trusts give this privilege to people who don't have the specialists, who are not on the specialist register, but those are few and far between. In general, if you want to get onto the specialist register and become substantive consultant, you have to give all parts. This is one of the steps, and it's not enough. It's a necessary step, but not sufficient step. Yeah, as I talked about, you can get some advantage in job interviews in the GCC countries. Maybe it can push your salary up. You could, in the when you prepare for the FRCF exam, as the previous speaker mentioned, you can learn some skills which are usually skipped in our Indian exams, like communication skills. She mentioned hand hygiene, several other skills, dealing with patients who are blind, how you're supposed to approach the patient, low vision aids. These are considered very important. There are a lot of attributes which are considered, not considered mainstream in India, which are considered very important in the UK. So I think if you learn those skills, they will benefit you even in your practice in India. Of course, you don't get any younger. You can't turn back the clock, not as yet. So this is one of the things that I regretted when my friends were writing FRCS exams. Just after the MS, they started preparing. I was like, bah humbug, why do you write these exams? I don't need to go anywhere. And then at the ripe old age of 37, I found that I had to go to the UK. And then it is more difficult as you get older. It's not impossible. It's more difficult to do your to go through your old textbooks and everything once again in between when you are engaged in a busy practice. So you can do it as an insurance policy. There are a lot of things that are not looking rosy in India, like it or not. When you talk about any kinds of scenario, professional, personal, or political. So if you are on that boat, then it might be a good idea to use this as an insurance policy should you have to jump ship. There's a fear of missing out when your friends are doing this and you don't have it. So that's there. Of course, you get bragging rights. It's a very prestigious exam. You can write those nominals. But of course, you have to pay the fees. You are not supposed to use the pros nominals without paying the fees. So if you've noticed on my presentation, I have not mentioned FRCS Glasgow because I have stopped paying the fees. The Royal College fees, both to put together, is a big amount. I decided to stick with one Royal College and not pay the other. But you get bragging rights. The drawbacks it's one of the tougher exams to crack. It is not as easy as FRCS or Glasgow. I'm not saying it's easy, but it is much tougher than FRCS Glasgow. There are a lot of elements in the curriculum that are not relevant to the Indian curriculum or not taught in India. So you need to, like the driving license standards and many other things, many guidelines which are not directly applicable in India. So many guidelines where you may think doesn't fit what's the usual practice in India is. So you have to actually rewire your brain to keep those nice guidelines in mind when you go for writing the FRCF exam. And then if you plan to stay back in India, then you have to forget that again. So that mental gymnastics you have to do if you are just planning to stay in India. In any case, I don't think it's worth writing the FRC if you're not planning to go out of India. Patients, I don't think they bother too much about these post-nominals, at least the patients in the part of India where I worked. And they only look at how your demeanor is and how good you are with your skills. I don't think the employers also really look at it. Maybe you have some advantages with UPSC and all, I'm not sure. Just for post-nominals writing this tough exam and paying that high fees, I'm not really sure whether that is a good option. Then the fees, these are the latest fees that I got from their website. It keeps increasing, as the other speakers mentioned, every year. Right now, if you write all the exams in India, you have to pay more than 5 lakhs. And the rupee is not getting any better compared to the foreign currencies. I think last check, it was around 105 rupees per pound. And that also weighs against you, not just the exam fees going up, the exchange rate worsening. So if you're writing all the exams in India, then it costs more than 5 lakhs, definitely. If you pass everything in the first attempt. If you write in the UK, obviously the fees is lesser, but then you have to pay the ticket fees and this the price for hotels. So that issue is there. And then you have the issue of paying the yearly membership fee. The yearly membership fee is discounted for Indians. Discounted for people who are not staying in the UK. It is higher for consultants in the UK, slightly lesser for associate members and people who are not consultant, but it is pretty high. So before you start the journey, look at the risk-reward ratio. It is a grueling journey. As far as my journey was concerned, I had to get to the UK quickly. So I started my journey in February 2022, where I wrote FRC Part 1. And I finished all the parts of FRC and FRCS by about October 22. Now, that was because there was a compulsion to get into the UK by November, because my wife was going to immigrate. I needed to accompany her, and I couldn't sit without a job here because you can't live with one person's salary in the UK. That is the motivation behind me going through these steps. But of course, I had support of my spouse, and she helped me a lot with childcare and everything during that period. I was working in a busy practice at that time also. It was a mixture of luck as well that I passed the exams. I did not pass all parts at once. I failed the refraction certificate purely because I didn't know that it was going to be on iPads. So these are small things which you can pick up from from talking to people who have passed this exam or written this exam before. I was only practicing the refraction certificate by writing on a paper, and all of a sudden it was an iPad. And I wrote everything on paper, and then there was not enough time to transfer over to the iPad, and failed by a few marks. So I had to give it again, and I had to go to Glasgow to give the exam. But I could complete it by October. Again, no one size fits all. Everybody's scenario is not the same. Everybody has different conditions. So each person's individual circumstance should be considered. And the one thing that I advise you shouldn't do, which I see a lot of my younger colleagues doing, is getting onto the bandwagon. The bandwagon effect is immense. Just because your seniors or your colleagues are writing this exam, you go write the exam. Just because my colleagues are doing this fellowship, I'm going to do the fellowship, without having a clear idea of what you're going to do in the future. So don't get on the bandwagon just like that. Have clear ideas about where your future is going to be, and you won't waste a lot of time in it. Thank you for my patiently listening to me. And I end with this quote by the great Swami Prashobhananda, that hard work and talent are overrated, and success has a lot to do with privilege and luck. Thank you. And don't be like the other CEO who asked you to stare at your wife. I mean, why do you want to stare at your wife for during the weekend, work 90 hours? I'm not part of that gang. All right, thank you. I'm ready for any questions.
So thank you, Dr. Prashok. So he has really thrown light into the real life scenarios. So now we have few questions from YouTube. So these are also scenarios. One person want to go abroad. Abroad means they're planning to shift to Middle East. So among these exams, FICO, FRCS, and FRC Ophthalm, which one they actually need to write if they want to? They're planning to shift only to Middle East countries.
So I have limited knowledge in this regard, but I have done a little bit of research, so I can tell you whatever I know. So in the Middle East, where the Middle East is a big area, so if we were talking about Dubai and Abu Dhabi, they are the most coveted areas. The other parts, Qatar, Kuwait, and Saudi Arabia, are less coveted, but lucrative nonetheless in terms of what you can earn. But I can talk to you about the criteria for Dubai and Abu Dhabi are very clearly defined on their website, on the Ministry of Health and HAAD websites, where again you can become a specialist. You can go to up to the level of specialist with your Indian degrees. There is no absolute mention of FRCS, Glasgow, or Edinburgh anyway. But I guess it does give you weightage in your interviews, where the owner of a hospital is interviewing you, maybe they give a additional weightage if you have FRCS. And having FRCS automatically does not give you any privilege to become a consultant. Becoming a consultant in the Middle East, in Dubai or Abu Dhabi, Emirates, is very, very difficult for an Indian graduate. Let me be very clear. They have certain qualifications which are tier 1, some which are tier 2, some which are tier 3. And it's a complex table that they have, where so many years of experience after each qualification gives you so and so. So FRC alone is not considered in anything. So if you have a certificate of completion of training from the UK, that is, if you have done your training in the UK and you have FRC, then it's considered quite significant. You can more easily become a consultant in the Middle East. Or if you have done your CESR, or the portfolio pathway as it is called now, along with that, of course, you have to do a FRC if you want to go through that pathway. Then you have certain number of years of experience. I think 5 to 8 years after you become a consultant in the UK. Then you can become a consultant in the Middle East. But you can very well become a specialist. You can go up to the specialist grade in the Middle East. That's my idea. So if you have plans to go to the Middle East, I think maybe the right mix would be an FRCS. If I'm not wrong, if somebody else has more knowledge about it, enlighten.
Dr. Devendra, please. Yeah, Dr. Chaitanya, please go on.
In Middle East to work, actually Indian degree is enough. For the specialist level, you need minimum number of years. But as Dr. Prashok said, for the consultant level, FRCS is not a must. But if you have FRCS, then also minimum 2 years work experience at UK is now the preferred practice for even at Middle East. With FRCS alone, there is no added benefit.
I tend to slightly disagree with that. UK experience alone, I mean, as far as the table that I've read, UK experience alone is not enough. You need to have actually complete your training in the UK. You have to do the CCT. That's 7 years of training.
FRCS plus UK experience, that training experience, along with the number of years of experience to the consultant level. That is when needed to register a consultant.
So
Only
if you have,
you have the number of years of experience, and only along with that, only FRCS is not any added benefit they are giving at the Middle East right now. That's the situation.
So do you need FRC Opt basically? So if you want to become a trainee in the UK, you have to do FRC Opt. And you can't become a trainee anymore in the UK with if you have done your MS already from India. You can only go through the portfolio pathway or the Caesar pathway. And then you need 5 to 8 years of experience after becoming a consultant in the UK. So basically, I think being a consultant in Emirates is more or less possible, practically. So if you work in the UK for 5 to 8 years, then you might as well settle down in the UK. Why would you go to the
So I think most of the people have this misconception that most of them are preparing for FICO as well as they prepare for FRCS, thinking that if they have these degrees, they will have more job opportunities in the Middle East. Dr. Grisha, do you have any idea on is like FICO holds anything, any benefit in getting job opportunities in the Middle East?
I don't think so, ma'am.
So
As
FICO,
far as no, as far as conversations with the people who have gone abroad, especially to the Middle East, they have not mentioned anything about that. But FRCS definitely has more weightage over FICO if you want to work in Middle East. But FICO, I don't think so.
I think all of them are very clear that they are not licensing examinations except for the FRC Opt. FRCS and FICO are very clear that they are not licensing examinations. They are not held as valid degrees in ophthalmology anywhere in the world. So you will only get a value addition, but it is not going to give you a basis for application as a consultant or for a job opportunity anywhere. So it is only the intangible benefits that you are going to get in terms of, as you know, mentioned, prestige or bragging rights, however you wish to, word it. But that's pretty much it.
So among these exams, according to what I have understood, FRC is the toughest one, right? But it is
Because it's a
mandated.
licensing exam. So you can understand the benefits go hand in hand with the degree of difficulty and the cost, as well as the number of people who pass or the percentage of people who pass. All of that, sort of converges because it is a licensing examination, whereas the others are not. So they can afford to be a little more lenient, and they want a larger pool of people who are applying. But that doesn't mean that, as Dr. Prashov rightly pointed out, you should know why you are giving which examination. You have entered ophthalmology, you have to complete your post-graduation. You have to, at the end of the day, get your MS or DNB or diploma. Above and beyond that, everything is just your, your choice in a sense, or the path that you choose. If you choose to go abroad, then obviously you'll have to give those relevant examinations. If you choose to practice in India, you may not give anything, or you may want to give examinations to differentiate yourself from your peers. So these are all your individual paths that each of you will take.
So then one person was asking, like, he just wants just nominals behind his degrees. So
Sure.
in that case, which one he should appear for, FIC or FRCS?
All of them. Why do you want to stop at one? The reason is that, especially with the combination of FICO and FRCS, because of the cross exemption, you end up, getting both the degrees because of exemption from some of the parts. So when I gave the, I was not planning to give the ICO, but when I was wanting to appear for the FRCS, I realized that the examination, I would have to wait for a year because I missed the dates, because the examinations are held once a year. Whereas I could appear for the ICO examination in April and then subsequently appear for the second part 6 months down the line, and because of the cross exemption. So these are plans that you can make, tactics that you can use. But at the end of the day, if you're only doing it for that, then why do you stop at one? Why don't you go as far as you can? Because the critical period is during your training and just in the next 5 years, when you are really in touch with the theory aspect and you have a flavor of clinical practice. Beyond that, it becomes more difficult. I'd like to just commend, I always like to mention Dr. Vijaya Paranjpe from Thane. She appeared for the FRCS at the age of 52. So we were discussing age as a bar. There's definitely no bar, and there's no age for learning. So you can always appear for these examinations, even just to satisfy your own your own sake of giving examinations.
I have a small addition to give to this. There are no exemptions to the FRC Opt, but the same thing works vice versa. So FRC Opt Part 1 gives exemption to FRCS Glasgow, and Part 2 also, I think, gives exemption to FRCS Glasgow written exam.
Yeah, the problem is that if you're sure you're doing FRC Opt, then you'll give the Part 1. But if you're using FRC Opt as a stepway to get into the FRCS, you probably will be better served by doing the ICO or the FRCS itself, because your pass percentage and the cost of doing the examination will be much less than doing the FRC Opt.
Exactly. Contrary to popular belief, counterintuitively, FRC Opt Part 1 is the toughest exam. Part 1 written. Part 1 written is the toughest exam because there's a lot of genetics, a lot of
basic sciences,
a lot of statistics, a lot of basic sciences, a lot of things which you may not have read. So it has, I think, the lowest pass percentage the last time I checked. So it is not a good idea to do that to get into FRCS, but that's the pathway I took. I wrote the FRC of Part 1 first. But that's because I had no choice. That was the first exam that came my way. I wouldn't advise anyone to do that if their goal is FRCS.
So one more question. What position will one get after passing FRC of in UK? What is that position mentioned?
You don't get any positions in the UK passing anything. That is the thing about the UK. You get GMC registration. You pass all parts of FRC Ops or all parts of FRCS Glasgow. Now, there are different types of GMC registration. One is called full registration. Full registration basically means equivalent to our general register in the NMC. I don't use the word general register because there is a separate register for general practitioners in the UK, which is called the GP register. Now, general practice is considered a specialty, sort of a specialty in the UK. So, not called general registration, it's called full registration. If you want to get into the specialist register, want to become a substantive consultant, you need to go through a lot of paperwork and evidence submission. That is a whole webinar on its own. Not one webinar, 10 webinars. It's a big process. But you can get up with a full registration. You can be a specialty doctor. You can be a trust doctor. You can be go to associate specialist. You can be a specialist, or you can be a locum consultant in the NHS. Locum consultant means you get all the privileges and the salary of a consultant, but your contract is limited. You have to renew it either every year or every 2 years or every 1.5 years. And there's no job guarantee as such. You may be out of contract if the trust decides they don't have the funds for it or for whatever reason. And the problem is initially, until you get the indefinite leave to remain, which is the permanent residence in the UK, your visa is sponsored by the trusts that you work in. So if you're out of work after, say, 1.5 years, you have to leave the country. So that would be a job insecurity, but you can work as a specialty doctor. There are substantive specialty doctor posts where you get long visas, but you don't get many privileges that a consultant has. Has its advantages in that you have less responsibilities, but the salary is also slightly less, and the privileges are also less.
Okay, so one more question that we have is, if we clear all the FICO standard exams and then clear FRCS practicals, will we get the FICO degree? Dr. Grisha? I think no.
No, you get the FICO post-nominal initials only in 2 situations. If you have cleared the advanced examination, or if you go for a fellowship, a 3-month or 1-year fellowship, and do the actual fellowship and come back. So these are the 2 situations where you can then write FICO after your name.
Okay. So one more question, is there any age limit for that FICO fellowships, the 3-month and 1-year fellowships after clearing?
To the best of my knowledge, they are limited to under 40.
Under 40.
Yeah, there may be exceptional situations where they will grant you a fellowship above the age of 40. But to the best of my knowledge, you would you need to apply. Actually, you need to get selected before the age of 40.
And any advantage of these fellowships in applying for jobs in Middle East or UK, everywhere?
No, not tangible, but it is definitely an eye-opening, a great learning experience. Like I mentioned, they are most of the time, I would say 99% are observerships. You don't get real surgical experience. You can't beat India for surgical experience. So, and you would be going abroad, predominantly you would opt to go abroad to the so-called Western or developed world. There are ICO fellowships available in SAARC countries also, South Asian countries also, like Pakistan, Bangladesh, Sri Lanka, etc. I don't think as Indians we may prefer to go to these countries, but you would probably be targeting the so-called developed Western world. So it's a great learning experience. I know people who have done the fellowship and gained a lot of intangible learning, networking, writing papers, forming international collaborations. It's a great experience, and obviously living and working in another country where you are being paid a stipend and your to a large extent your expenses are taken care of is a wonderful experience for anyone to have.
I absolutely agree with Dr. Devendra. The best place to learn, get your clinical skills and your surgical skills is India. Nowhere else beats India. Due to simply the volume of patients that you have, the repetitive experience, that the frequency with which you can call the patient for a follow-up, know what you've done is right or not. That is not there. It's lacking in many of the so-called Western developed countries. So if you want some of the intangible benefits, as Dr. Devendra mentioned, some of the soft skills, how to behave, how to communicate to the patient, and there are a lot of other things that you may gain from some of these fellowships. But clinical skills and surgical skills wouldn't be one of them.
Okay, so I think we have cleared most of the questions, and it was a very fruitful discussion at the end. Anybody has any more questions? I think no. So thanks a lot, Dr. Prashop, all the speakers, Dr. Chaitanya, Dr. Ann, Dr. Grisha, Dr. Samir, and Dr. Pranita for their comprehensive talks on these topics, and Dr. Devendra, especially for your valuable inputs on each and every topic and for remaining with us till this time. Dr. Prashop, sir, for joining from there. I know it's an odd time there. So thanks a lot. I think this webinar is going to be very useful. It will be available in YouTube. Everybody can rewatch it. So it will be very useful for anybody who have doubts on when to write this exam, whether to write this exam or not, and how to prepare and how to plan the strategy for writing all these exams. So thanks a lot to KSOS, Bastin sir and Yossi for this opportunity for helping us in conducting this webinar. So let's wrap it up. Thanks a lot, everyone. Good night.
Thank you. Good night, everyone.
Thank you. Thank you.